Good morning, everyone. Welcome to COVID Vaccine and Students with Disabilities. It's my pleasure to introduce Lisa Shulman, who is the Interim Director for the Rose F. Kennedy Children's Evaluation and Rehabilitation Center and the Division of Child Development at Montefiore Albert Einstein College of Medicine. Dr. Fiore has extensive experience working with children with autism spectrum disorder, as well as improving access to care for underserved populations, identification and management of early motor delays and toe walking gait. From 2008 to 2009, Dr. Shulman has been named one of New York's super doctors, best physicians as chosen by their peers. She served as the Center for Disease Control Act Early Ambassador to New York State from 2016 to 2019. Dr. Shulman is board certified by the American Board of Pediatrics in pediatrics, as well as developmental and behavioral pediatrics, and she sits on the National Autism Subcommittee of the American Academy of Pediatrics, and is a member of the Society of Developmental and Behavioral Pediatrics and the International Society of Autism and Research. We are very fortunate to have Dr. Shulman here today to talk to us about this very important topic. So I will turn it over to you, Dr. Shulman.
Thank you, Jennifer. It's an honor to be here talking about what I think of as one of the most important topics these days. And by way of introduction, I want to explain a little bit what a developmental pediatrician is. So a developmental pediatrician, like myself, is somebody who went to medical school, did a residency in pediatrics. So I've got kind of the medical background. And along the way, I got interested in complicated children, such as premature babies who were in the NICU. And we saw it in follow-up and had various developmental issues and genetic conditions. And so after I finished my residency, I chose to do a fellowship. So that was 3 more years. To specialize in developmental and behavioral and neurodevelopmental problems at the Rose F. Kennedy Center in the Bronx, New York. And those 3 years are like an apprenticeship, during which at this large center, I learned what the psychologist, what the speech, what the occupational therapist and the physical therapist, nutritionist, audiologist, special care dentists, et cetera, contribute to the care of children with developmental disabilities over many, many years. So this is a center that follows children with and makes diagnoses of developmental issues, and then follows those children into adulthood. And as part of that care, I have been very aware and interested how loaded a topic vaccination has become over more than the past decade. So I have been speaking on vaccination before anybody was talking about COVID-19, and that background about vaccine hesitancy is really critical to understand as we talk about current issues and concerns on the part of parents when it comes to vaccinating their children, your students, family members with disabilities. So I'm actually going to take us back kind of to some of the issues that are very basic to current issues about vaccine hesitancy. I think these days, more than ever before, we've become aware that it's extremely important to always look at the source of the information we are given, to understand that everybody comes to a topic with their own history and their own potential biases. So as we embark on our discussion about vaccines, I want to share that I have no financial disclosures. I am not paid by any companies that make vaccines. I am not in the business of developing or selling vaccines. I don't serve as an expert witness for or against cases alleging damage from vaccines. I don't purchase or bill for vaccines. My goal for today is to give you evidence-based information to help make informed decisions about vaccination and to give you the background that would be helpful to work with families. And if you are a family member, to make your own decisions, but without biases. Okay, so our outline for today is going to be a brief history of vaccines. Then we'll turn to a history of the anti-vaccine movement and vaccine myths. And we'll end up talking about the COVID-19 vaccine. Okay. So I usually like to kind of drive home that if you were born before 1972, as I was, and you roll up your sleeve, you will see a scar. And that is a scar from the smallpox vaccine. And if you were born after 1972, you will not have that scar. And that scar is testimony to the power of vaccination. I got interested in this topic for a couple of reasons, but one of them was that I felt in my childhood that I was ever being reminded by my own mother how lucky I was. Thanks, Mom, for being able to get vaccines that had been such a scary, against very scary illnesses of the past, namely polio, which left many children handicapped, unable to use their limbs, on an iron lung, dying. I was involved in a book group, and this was like 5 years ago. And the book group that included peers of mine read the book Nemesis by Philip Roth. And this is from the back of the book. It says, in the stifling heat of equatorial Newark, a terrifying epidemic is raging, threatening the children of the New Jersey city with maiming, paralysis, lifelong disability, and even death. This book describes a wartime polio epidemic in the summer of 1944. And I arrived at the book group. I found the book, a really riveting discussion on this topic, to find my friend next to me, who's exactly my age, saying, this is science fiction, right? And I was like, no, this is real history. And it just told me how the further we get from seeing certain illnesses and having any personal experience with them, the more we need to be reminded of how important vaccines have been in maintaining safety and health. And that's the situation that's ripe and currently going on for the current generations of parents now who have not had contact with any of these really scary illnesses until now with COVID. So let's start with a brief history of vaccines. Okay, so vaccines are one of the most successful public health tools for saving lives and preventing debilitating illness ever. And it's particularly relevant to children. So families used to have a lot of children, and part of that was because you could expect about a fifth of your children to die in early infancy or childhood of now preventable diseases due to vaccines. Over the last half of the 20th century, diseases that were once common became rare due primarily to immunization. And they truly prevented the deaths of hundreds of millions of people. So let's go back to kind of high school biology. How do vaccines work? A vaccine trains the immune system to recognize and fight viruses or bacteria. To do this, certain molecules from the virus or bacteria must be introduced in the body to trigger an immune response. Those viral or bacterial pieces are either killed or non-active. The molecules that are injected into the body are called antigens. And by injecting those antigens into the body's own healthy immune system can safely learn to recognize them as hostile invaders and produce antibodies which fight antigens and remember them for the future. So if the bacteria or virus reappears in their system, the immune system will recognize the antigen immediately and attack it and prevent a full-fledged infection. These days, you hear a lot about herd immunity, and they capture the concept that vaccines don't just work on an individual level. They can protect entire populations. Once enough people are immunized, opportunities for an outbreak of disease become so low that even people who aren't immunized benefit. Bacteria or viruses simply won't have enough eligible hosts to establish a foothold and will eventually die out entirely. So during this whole COVID era, we've been hearing, well, what will it take for us to get to herd immunity, or what we used to hear called community immunity in the past? Because that's what has allowed really devastating diseases to be eliminated entirely without needing to vaccinate every individual. So that's what happened and why smallpox was eliminated. And the basic concept, as kind of depicted in this picture, is if someone who's contagious with an illness, let's say COVID, encounters someone who is susceptible because they have not been vaccinated or have not had COVID, then that individual will become ill, although possibly not symptomatic, but importantly, they will then be able to pass that on to someone else. They are contagious. Whereas an immunized individual who encounters a contagious person will not be able to pass that on and will not continue the contagion of the illness. It stops with them. And that's why you're kind of seeing that in this picture, all those blue people on the outer rim are not going to be infected, whether they were immunized or not. So herd immunity is critical because there will always be a portion of the population that either cannot be vaccinated or cannot mount a response to a vaccine. That may include, as we're dealing with now, children under 5, young infants, the elderly who have compromised immune systems, people with certain severe allergies, depending on the vaccine, pregnant women, or people with compromised immune systems for other reasons. So thanks to herd immunity, these people are kept safe because diseases are never given a chance to spread through a population. So let's go back to discuss smallpox. The year is 1796. Smallpox was the deadliest disease of all time. In the 20th century alone, it was responsible for 300 to 500 million deaths. It's highly contagious, and 30% of individuals who contracted the disease died. Edward Jenner was a natural-born kind of scientist, and he invented a method to protect against smallpox in the 1700s. He had observed that milkmaids who milked cows were observed to get certain pox illnesses, like on their fingers, and then they didn't seem to get smallpox. So he thought, without the ability to scientifically confirm this, that there was a relationship between cowpox and smallpox. And so he took a small amount of pus from the milkmaid and actually put it in his own child in a cut that the child had, baby. And that ended up being protective. That was kind of the first vaccine. By the late 1940s, scientific knowledge had developed enough so that large-scale vaccination production was possible. And by 1977, smallpox was vaccinated out of existence. There's the milkmaid's finger and somebody looking at it with a magnifying glass. Here's Edward Jenner, literally giving his baby exposure to that cowpox pus. Well, as soon as the first vaccination effort started, so did vaccine misinformation and fear, leading to hesitancy. This is a picture from the 1700s showing the vaccine as a snake and a mother protecting her infant from it. This picture captures the idea, oh, this is from cows, you're going to turn into a cow if you're given this smallpox from the cowpox. The next set of vaccinations, formal vaccinations injected, didn't arise until the 20th century. And these included vaccines that protected against pertussis, diphtheria, and tetanus. Again, deadly conditions, especially affecting children. These three vaccines were combined in 1948 and given as the DPT vaccine. But surely polio and the polio vaccine in 1955 was the vaccine everyone was waiting for. Parents were terrified of the polio epidemics that occurred each summer. They kept their children away from swimming pools, sent them to stay with relatives in the country, clamored for a way of stopping the spread of polio. They waited for a vaccine. There was a whole campaign, and families sent dimes to the White House to help support the science to develop the vaccine. When the polio vaccine was licensed in 1955, the country literally celebrated with a parade. Jonas Salk, its inventor, became an overnight hero. That was the environment of how scared people were, with good reason, of polio, and how they saw vaccines as the way out and back to a normal life. And it seemed that measles was going to follow the same path that smallpox had been, in that it would be able to be eliminated. Measles is more contagious than smallpox. It can cause deafness, blindness, encephalitis, and death. And the way measles elimination was going, they thought it would be eliminated first in 1982, when the number of cases was down 80%. Then there was a measles outbreak, and that led to recommendation of a second dose. Kind of sound familiar? This is an evolving science. By 2000, measles was declared eliminated, although every child and college entrant was still being vaccinated. And then before it could be eliminated, in 2015, there was a well-publicized outbreak in Disneyland of measles. And it became clear that one of the things that had contributed to that outbreak was the anti-vaccine movement that we're now going to take a step back to review its roots. But what was happening was that herd immunity had been lost because too many children were not being vaccinated, and therefore able to get measles on their own and pass it on. So in thinking about what was contributing to the renewed epidemic of measles, the thinking was it had become taken for granted that a child born in the developed world would grow up without fear of paralysis, brain damage, blindness, and death from measles, because the generation of parents who were raising those children and making decisions about their health, and even some of their grandparents, had never seen these diseases. And so then, rather than the fear of the vaccine itself, concerns began to grow over risks that vaccines might present and side effects. So people weren't fearing the diseases anymore. They were fearing theorized, postulated vaccine risks or side effects, and vaccination rates fell, and diseases once thought eradicated became prevalent again. Okay, so let's look closer at the anti-vaccine movement. So there are various myths that the movement perpetrated, and they're going to sound familiar because the same themes were raised and continue to be raised, one after another, regarding different vaccines. So myth one arose in 1982 regarding the diphtheria, pertussis, tetanus vaccine, saying that it caused developmental disabilities. There was a documentary that aired in 1982 called DPT Vaccine Roulette. Take your chances with this vaccine, basically. And the topic of side effects, negative side effects causing developmental disabilities from the pertussis element of the DPT vaccine, that were discussed and shown in that movie, were brought to news channels. And here was the allegation. The pertussis component is causing harm. Media covered the story as fact. And within months, this DPT vaccine roulette program was, or segments of it were shown on many local and national news outlets. Then there followed a flood of lawsuits claiming that the pertussis vaccine had caused every possible problem in young children. Now, remember, young children, that's the age when they will receive, because they can mount the response and benefit and no longer have their mother's immunity that they received while in utero and lasts for about 6 months. That happens to be at an age at which many different conditions become manifest. So the DPT vaccine roulette had shown a child developing severe seizures. Timing was around the time of receiving the 3-shot series of the DPT, well, a year before the child had received the 3-shot series of the DPT. As the science matured, it became clear that pertussis had not contributed to the development of these seizures or developmental disabilities. As our science has increased, there were able to be studies that looked at populations that had and hadn't received the DPT, and there was no evidence of increased risk for epilepsy or developmental delays. And as genetics studies were able to be done, and this is even more recent and current data, it showed that children who had developed these developmental delays and seizures had a particular genetic mutation for a condition called Dravet's, and they would have developed it regardless of whether they were vaccinated or not. This was in their genes. But the studies came too late to stem the fear, and so parents continued to have fear and hear misinformation. So organizations using that fear. And there have been populations that have become more and more vaccine hesitant. But none of that vaccine hesitancy has been as entrenched as the idea that the measles, mumps, rubella, the measles component, causes autism, which arose as a myth in 1998. So here's the lay of the land. The majority of children with autism, we do not know what causes it. To be honest, now that genetic testing has improved, we can identify the cause of autism in about 20% of children, and it is genetic. But what about the other 80%? And as autism was being diagnosed more often, it really was a very, very ripe situation for postulating potential causes. In 1998, a British gastroenterologist named Andrew Wakefield claimed that he had found the cause of autism, and it was the measles component of the measles, mumps, rubella vaccine. He reported data that was studied in a very well-respected journal called The Lancet on 11 children with regressive autism who underwent endoscopy, a gastroenterology procedure that involves taking little samples from the gut. And he said that the children who underwent this procedure and who had developed regressive autism, where they were fine and developed symptoms of autism after the vaccine, those little biopsies from the gut had shown that there continued to be measles virus that hadn't been cleared in the gut. And it was reported as a very unusual finding. And he published this, and again, the way science works is it is published for consumption by other scientists. And then he took the unusual route of, instead of having this be part of media, he began to speak about this for government agencies, as well as, again, in the media, in an effort to make this known and change vaccination approaches. And it made it to 60 Minutes. Okay, but the way science works is that once something is published as a finding, then the next researcher group replicates that to show it wasn't just chance and builds on that. And research groups after research groups could not replicate those findings, which inevitably raises the question of what was going on. So enter an investigative journalist, Brian Deere. Okay, so he said something isn't right here. And his research identified that Wakefield had misrepresented clinical and biologic data in the paper. Brian Deere interviewed other people whose names were on the article, got in touch with the 11 families. Turned out that the 11 families whose children had this procedure of regressive autism didn't have regressive autism. He had taken their blood at his son's birthday party, that there were financial things that were not being disclosed, namely Wakefield and several of the families involved in this group of 11 had a patent on a safer measles vaccine, and so had a lot of things to gain by throwing out the current measles vaccine and having people adopt this safer measles vaccine. And so, again, it's very unusual. It takes a lot of data showing that a study was not done appropriately in order for a journal to retract the paper, basically say they no longer stand behind it. This is not going to be part of their archives and considered a publication of repute. And that was what happened. He lost his medical license. He actually moved to the United States. It led to repeated, very large scale studies done, looking at groups of children who were vaccinated with the MMR and children who weren't vaccinated with the MMR due to problems with various components in various populations. And these were large scale, many large scale studies. And in each case, the prevalence rates of autism in the population who received the MMR and the ones who did not receive the MMR was the same. To be honest, it continued to increase in both those populations. And this dispelled the allegation that the MMR caused autism. That's how science works. Then that became the story on the news, that the autism vaccine study had been a fraud. So now we're at 2011. And you can see how the toll this has taken on now Andrew Wakefield, who's now on a far-right conspiracy theory show, and looks like he's been through the ringer. But the damage was already done. And, above all else, as parents of children with developmental issues, nobody wants to feel like they could possibly do anything to cause harm. And so the group of families who have personal experience with autism or other developmental disabilities are known to be among the most vaccine hesitant that there are. And so long before COVID, it was very common for me to arrive in the clinic where we see thousands of children with autism and see sitting side by side in the waiting area, families that I know do not vaccinate, sitting side by side with families who have come from communities where there is a known measles outbreak. It's very scary and nerve-wracking. And each visit with the families is designed to counsel toward vaccination for the safety of the child and others. So the impact of Wakefield's paper officially was thousands of parents in the UK chose not to vaccinate. Hundreds were hospitalized and died with measles. Families in the United States followed suit. And then in 2019, it seemed like the tide was turning. There had been another round of measles outbreaks, actually in this area and elsewhere in the United States, and it seemed to have turned public sentiment against the anti-vaccine movement. And there was a study that showed that 85% of parents of children with autism didn't believe that vaccines were the cause. And California was passing laws requiring vaccination and not allowing religious and other exemptions. And it really seemed like we were tilted in the direction of overcoming vaccine hesitancy. Getting back to that in a few minutes, I want to raise another myth that's important to know that was that thimerosal, or a mercury-containing element in multi-vial vaccines to stabilize them, was causing the autism. And this came from the idea, here's the Mad Hatter from the movie Alice in Wonderland. And apparently it was known that people who worked in derby hat manufacturing processes were more likely to go crazy. I mean, that was the vernacular of the time. And so the Mad Hatter is calling upon that knowledge. And it turns out that the process of making derby hats involves dealing with mercury. I don't know how that is.
Can you tell her?
Okay. And so a group of parents at a parent group were sitting around in the late 1900s. All of them had a child with autism. And I can understand how the thought process went. The kind of measles component being the cause of autism was kind of presented and kind of dying out a bit. And they were sitting around and saying, well, what is different? Why would all our kids have autism? Why would this have developed? What has changed? And so there were a couple more theories they were throwing about. And one of them was, well, they do get a lot of vaccines that they didn't used to get in the past. And they learned that this mercury-containing element was used as a preservative in vaccines. Now, the mercury-containing element is not the same one known to cause harm to the developing brain, but still mercury. And so they brought this concern to vaccine manufacturers and the Public Health Service that thimerosal should be taken out of all vaccines given to young children. And again, that led to repeated studies that did not show a relationship between thimerosal, the mercury-containing preservative, and autism. But out of an abundance of safety awareness, thimerosal was removed as the preservative from all vaccines except for the flu, which is still sent around in these multi-vial containers that are stabilized with thimerosal. So anyone who continues to raise this concern, it is based on misinformation or allegation that it's a cover-up and they're still using thimerosal, even though they aren't. But regardless, it was disproven as a cause of autism. Okay. And then a last myth I want to raise is that too many vaccines overload the immune system and in general are not good for the child. And this contributes to parents not wanting to vaccinate or slowing down the vaccination, letting the child be susceptible to illnesses because they are not getting them on time. And it is true, certainly over the years, children receive many more vaccines than they used to. But it is important to recognize that the technology has tremendously improved. So for example, in the 1980s, children received 8 vaccines, and the total number of those bacterial or viral antigens required to elicit a response, an immune response, was about 3,000 antigens. And because the technology is so much better now, even though children receive far more vaccines against 14 diseases, the total number of antigens is only about 150. So that concern does not correlate with the science. So can too many vaccines overwhelm an infant's immune system? There is no evidence of that. Logic doesn't suggest that. Infants are colonized with trillions of bacteria, each containing about 2,000 to 6,000 antigens each. And so the challenge from the 150 antigens in all of the vaccines combined is nothing compared to what infants manage to handle without infection every day. A scraped knee has more immunologic challenge than all childhood vaccines combined. Okay, so let's turn our attention to the COVID-19 vaccine. Okay, so we've just spent our first 40 minutes looking at the history of vaccine hesitancy that contributed to increased vaccine hesitancy among families with children with autism and other developmental disabilities. And it's super important to recognize that that history is the elephant in the room when it comes to parental vaccine hesitancy for any vaccine, including the new vaccines like COVID-19. So let's take our last few minutes to discuss the COVID-19 vaccine. So millions of children from 5 years to 18 years are now eligible to get vaccinated. And the CDC has endorsed the Pfizer vaccine for the 5 to 11 group and both the Pfizer and Moderna for the 12 and up. So just a moment on kind of what is an emergency use authorization. That's something that is provided in the context of something like a pandemic to say, we want enough evidence to know that the vaccine is safe. We'll continue to study it, but we want to get it out there if it is safe. And so First comes the emergency use authorization. We went through that with adults and teens, and those were then taken to the next level of being approved by the FDA. And with children, we have still been at the EUA. Now, some parental reasoning about why to not vaccinate their children has to do with recognition that COVID-19 tends to not be as much of a risk for children. But it is really important to look at the numbers. The virus has not spared all little kids. As of April 26th, this week, over 12 million American children tested positive for COVID-19. That's almost a quarter of all the cases. And 1,509 children have died from COVID. The largest number are in the 0 to 4 years. They are not eligible, but we have children in each of the age groups. And so during this period of time, COVID has been a documented leading cause of death for children. Children seem more likely to get this particular multi-system inflammatory syndrome in children that often leads to ICU admission, and 66 deaths have occurred, and the median age was 9 years of age. So those children who followed this path, even though it is not common, those were preventable illnesses in general for children 5 and up. On top of that, the majority of the MIS-C patients have been of Hispanic, Latino, or non-Hispanic Black race and ethnicity. They are disproportionately being affected by COVID-19 overall. So while severe illness and death from COVID is far more rare in children than adults, it does happen. And with vaccination, such tragedies are much less likely. Unvaccinated teens are hospitalized at 10 times the rate of vaccinated. So without any disagreement, the AAP recommended that all children be vaccinated. And pediatricians nationally have urged parents not to wait. You just cannot predict in a normal, healthy child who is going to get very sick and who is not. The children who have gotten MIS-C and died did not have underlying medical problems. So vaccinating is the best way to protect your child against getting severe COVID illness. A young child being vaccinated can also, as we saw from the herd immunity picture, decrease the chance of their transmitting disease to more vulnerable family members who, for a variety of health reasons or age, are not able to mount an effective immune response. In addition, as we hear on the news, transmission increases the chances that the virus will mutate, like we've been through and continue to go through, acquiring dangerous properties or more transmissibility. The other piece is that developmental disability is a risk factor for severe COVID. So a study of over 64 million US patients of all ages by the NIH showed that prevalence of COVID-19 was 4 times higher among people with intellectual and developmental disabilities. So this included individuals with autism, intellectual disability, learning disability, and other developmental disabilities had 3 to 9 times higher likelihood of hospitalization than those without these conditions and stayed longer in the hospital. And so the odds of mortality of dying in the setting of COVID was 6 times higher among patients who had an intellectual and developmental disability. We know COVID has had a particularly severe impact on our children with developmental disabilities. In addition to the increased risk of poor outcomes that I just went through, we follow many children in our center who have autism who could not benefit from remote or virtual learning media, who have not been able to get their early intervention or Committee on Preschool Special Education services during this period of time. And this group of children who parents and systems have worked so hard of making sure they've had appropriate social exposure because of social weaknesses or needing excellent models to learn things has been the exact group that now has not gotten that and has lost a couple of important years in their development. So what can we do about vaccine hesitancy in parents of children with ASDDD? Education, 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 information from trusted sources. When I speak to groups of pediatricians, I highlight how important the medical home is in sharing evidence-based information. They are a trusted source of information. Here at our center, our physicians are a trusted source of information. And so we were in a unique position to provide educational webinars, individualized input to families, and then also we became a vaccination site here. And that vaccination site was set up to be able to provide easy, non-traumatic vaccination by providers who really knew autism. And we were able to provide behavioral supports to vaccinate the population, sensory, relaxation, social stories, reinforcers. These have been to our families who said that the pediatric office was not able to vaccinate the child. It required the child being held down. The child was very, very upset. The child couldn't be vaccinated at Yankee Stadium or at CVS. So this setting where the children were often comfortable coming and the parents were comfortable coming provided a strategy for getting this done with the least amount of trauma possible. And so that was something that we will plan to do with approval of the under 5, hopefully. But we vaccinated 62 patients who were not able to be vaccinated elsewhere. So some quotes I want to leave you with, and then I'll be happy to take any questions, are: there's no two ways about it. The benefits of COVID vaccination clearly outweigh the risk for our kids. Jerome Adams, the US Surgeon General, under President Trump, had put it this way: we put them in seatbelts, we have them wear bicycle helmets, we put sunscreen on them to prevent them from getting skincare cancer 60 years down the road. The virus is unpredictable. We need to do everything we can to protect ourselves and our children against what this virus is very capable of doing. And then from the FDA, no child should ever die from a disease that could have been prevented by simply getting a shot. This is a topic for another day. Okay, I'd be happy to take any questions or comments at this point.
Please feel free to put any questions you have in the chat, or raise your hand and you can unmute if you want to add a question. I think, Dr. Shulman, if you wouldn't mind entertaining my question first as we wait. Some of the things that we've been hearing, and I think some schools have been hearing as well, is a concern that children with underlying medical conditions, which might be as well some developmental disabilities, are at risk with vaccines. Is there some problem with getting the COVID vaccine?
So I'm glad you asked that question. That is not the case. I'll actually start with, so that it's a common concern when anybody is medically complex, that they might have a reason why they shouldn't have the vaccination. With the COVID vaccine, that's the exact opposite. If you think about all the groups of people who were prioritized for vaccination, they literally were the ones who are the most fragile: diabetes, congenital heart disease, immune problems, hemophilia, seizures, cerebral palsy, genetic syndrome. Okay, cancer. I often give the example, my very first patient who was vaccinated at our clinic was a child with autism, developmental disabilities, and a heart transplant. The actual vaccine, so we just gone through that children with that, the reason to think that children with developmental disabilities, that might be a contraindication, comes from the whole history, debunked history that we've gone through. The demographics of the study population specifically included individuals who have all of these possible conditions, including neurologic disorders, which included autism and developmental disabilities. And it turned out the only contraindication, the only people at risk for an outcome, a negative outcome due to the vaccination itself, have a severe allergy to a single vaccine ingredient, which happens to be very, very rare. The component is polyethylene glycol, which is the main ingredient in Miralax, which is commonly given for constipation. So the counseling is, if your child has had no issues with Miralax, it is highly unlikely that your child will have an allergic reaction to the vaccine. The full list of vaccines is available on the COVID-19 website. It has very few things in it. So again, major medical problems are not contraindications for vaccinations. Rather, they are indications for aggressive vaccination. Autism is definitely, and developmental disability are definitely not risk factors for complications from vaccination. It's really important to know, like we just went through, that that comes from vaccine misinformation and about autism being caused by vaccines. That is not true. And in fact, in addition, children with developmental disabilities are more likely to have a severe outcome and die from COVID itself than other populations. And so it's just important to really understand. So another thing that sometimes comes up is the myocarditis has been the most serious side effect reported in the COVID-19 vaccination, more commonly in teenage boys than in any other, in young adults, male young adults than in other populations. That complication of myocarditis is far more common from COVID-19 infection than the vaccination. And it occurs in like 1 in 10 million teenage boys. At this point, you know, hundreds of millions of individuals have gotten the COVID vaccine without complication. And so it's important to, again, look at the information. But it is a common thing that parents, and again, it's the reason we took that whole historic approach of why that question is even asked. It's important to acknowledge that vaccine hesitancy among parents with children with developmental disabilities is the absolute elephant in the room. And you have to go all the way back to understand it and address it. But there is uniformity in opinion. They are not at increased risk of complications from vaccination, but they are at increased risk from poor outcomes from COVID.
Thank you for that comprehensive response. I can tell you that you know, it's challenging for non-medical providers to have a very good response to that because you know, often what we're presented with is, well, the science is constantly changing, they don't know. So having an authoritative voice from a medical perspective, as you said, a trusted source, can be very helpful. You know, another thing that I think what we're sort of gearing up for, and I encourage everybody else on the call to ask their questions too, but we're gearing up for is this idea of how many vaccinations of COVID-19,
Right.
like what does it mean to be protected? And, you know, right now there are certain dosages for school age, but how do I prepare as a family for, is that going to be enough? And, you know, how are you educating your patients about those type of, you know, future questions about what does this course look like? And maybe you can touch upon how other vaccination courses changed as, there
Sure.
were 3 doses. How is that similar? Is this normal, I guess, is what I'm trying to ask.
Well, everything's based on the evidence. So, I mean, the example I'll use is the measles vaccine. There was one measles vaccine. It was traditionally given at 12 months. And again, we were very close to eradicating measles at one point when it became clear that immunity was wearing off just around the time that kids were entering college. A second vaccine was given of measles at 5, and that sustained. German measles sometimes wears off, and it's really important that a pregnant woman be immune to rubella. And so when women are of childbearing age, people often check their immune status to see if it remains. So the idea of how long immunity lasts from vaccination is a known issue, and one that is, evolving for every vaccine. The reason we have influenza vaccines yearly is that, like it appears COVID is doing, the influenza virus mutates yearly. And so that's a new vaccine is required every year based on what the current mutations are. And I mean, at the beginning of the whole COVID epidemic, when we talked about the novel coronavirus, novel being the key word, that we don't know. And it really is an incredible accomplishment how quickly vaccines were established and tested and safe vaccines developed. And we're learning as we go. And it isn't unrelated that there's been lack of vaccination in certain places, lack of access to vaccination in other places that have led to mutations. Viruses mutate more than bacteria. And we're seeing a pattern where we're not getting to herd immunity. And the vaccine continues to mutate. And so it's kind of following more of a flu pattern, but it is a more dangerous type of infection than the flu. The people are dying on an order of magnitude more from COVID than flu, and it's affecting children in that way, not only the elderly. So we're not, other than it is novel and it is mutating more, and we're needing to learn as we go. And, I read things whenever I see anything. That's why I have the bags under my eyes these days. I feel like I have to read the news and the lay literature and the journals that basically say, well, maybe you want to hold off on your adult booster because if you're under 50, there'll be more taking into account of mutations in the next boosters that will be developed. So my recommendation is to follow the experts. I'm a believer in science. So I follow the experts and urge my families to do so as well. And so at this point in time, with an understanding that it is an evolving picture, and it's really evolving because as more people get infected, then kind of how long their natural immunity will last, how long vaccine immunity will last. Does natural immunity to one mutation protect you from severe illness from upcoming mutations that we don't even know about yet? Will help determine the recommendations. So it's, we're living through a unique time period with this virus, but we have the tools to address it.
So you mentioned that that it is incredible how quickly a safe vaccine was developed, but speed is this other myth that's sort of out there. I don't know whether you're getting these questions from families.
There's
I
nothing
should
you
sort
can
of wait. Yeah, but the science. I mean, I'm wondering whether you could touch on the science a little bit. It wasn't all developed in 1 year, right? So the science of the development of the vaccine is a building block, right? You build on the
Right.
knowledge of.
So
So I wonder if you could touch on that
Sure.
that myth for a few minutes.
So I would say that everything is like with science, how we said that you replicate and then you take it one step further. mRNA vaccines like COVID were being developed before COVID. They are being used in the treatment of cancer. The technology was being worked on and was available. And our experience with prior vaccines put us in a different position now in developing a new vaccine. We weren't starting from scratch. And on top of that, the funding and the immediate need for a pandemic meant that tremendous studies were being done concurrently in a way that's never been the case or the capability for previous vaccine development. So there were no shortcuts taken on this vaccine. And in fact, this vaccine is the best studied vaccine in the history of vaccines. But no, this wasn't a rush job that, we don't know if will turn into cows, 20 years down the line. That calls upon a myth I didn't include, which is what came up earlier on in the discussion was that COVID can impact fertility. And there's no evidence whatsoever that COVID impacts fertility. OBGYN associations, recommend vaccination for all, including pregnant women. But if you look at vaccine myths over the years, even with the smallpox, the idea that vaccination caused fertility is another one of those long-standing myths because it's scary. Nobody, above all else, wants to do something that could harm their child or themselves. So this idea, and that's where misinformation is so powerful, because misinformation plants a seed of concern about a theory, as opposed to side-by-side information, which is fact. But once you've heard something, it's so difficult to unhear it. And so with each of the myths, all the myths we're hearing with this, they were all there before. It's kind of like what we say about certain treatments that parents will consider kind of biomedical complementary treatments that parents will ask whether they should try to help their child's autism or other developmental disabilities. And it's like any treatment that is used for every possible condition, from eczema to heart disease, now being used or recommended to cure autism, probably doesn't work. Because it's another thing we learned from genetics, just how specific certain problems are. So you're raising all the key questions. I've done multiple webinars that have reached large audiences, and the audiences were offered to submit questions in advance. And we ran the webinar by making sure to address all the questions. And so Jennifer, you personally have raised the exact issues that are on most parents' minds. And it is hard as an educator or someone who is not a physician to answer these. And so my advice in the end, and why so much of this educational effort is directed at medical home providers, pediatrician, family practitioners, nurse practitioners, is that they often have longstanding relationships and are trusted sources of information. And so the guidance is discuss it with your healthcare provider about your particular case. But there is no particular case when it comes to this vaccine, unlike other vaccines. If you're not allergic to Miralax, and we're talking serious allergy, anaphylaxis, which has barely ever been reported to Miralax, there is no contraindication. In fact, what you're considering a contraindication is more likely an indication for priority.
That's a great point. Tim has his hand raised. Do you want to unmute yourself?
Sure. So Dr. Shulman, thank you for taking time today to meet with all of us. This was very, very informative. When I raised my hand, it was questions about the infertility. So I'm glad that you addressed that. But I'm curious regarding the influenza vaccination and the COVID vaccination in terms of hesitancy. Has there been any studies to see similar hesitancy with, a flu vaccination versus COVID, right? In our, as the PNA and doing the work that we do, we try to get information out to the public regarding vaccinations. And this is an uphill battle all of the time, because once it is said once, it is now become, oh, I heard of someone who they passed out when they got the COVID vaccine and they turned orange. Well, now that is just going to be repeated, and it's going to become fact, within. So I know that I've had a few things in there, but I'm curious about the relationship between the flu vaccination and COVID, if there are any statistics.
Having dealt with vaccine hesitancy literally for my entire career in the patients that I see, I would say it is very common that the families do not give the flu vaccine. The families of children with developmental issues do not get the flu vaccine. And they are just generally more hesitant for all of the historic reasons we went through, is my usual explanation. Minority families are historically more hesitant, and families of individuals with developmental disabilities are more hesitant. There are other populations that are also known to be more hesitant, Army families, and what happened with the measles outbreak in Disneyland. There were large communities, often very health-minded, or how they portray themselves is that they're healthy. They don't want to put any foreign substances in their child's body. And so, a lot of efforts have been directed at Hasidim, Jewish, communities. Sometimes we'll have, a leader who gives information. Certain churches have been very active in discouraging immunization. So it's labor intensive, but I have often with one family have been invited to speak to communities that have specific questions and concerns and try to provide information, but it's difficult. And again, there are different reasons why people are hesitant. And it's somewhat tied to history, just general concern about, above all else, not wanting to take any chances in terms of causing future harm. That has like that concern has a sort of psychological phrase that I can't remember what the name of it is, but anticipatory anxiety or something. Lack of confidence in research, in government. All of these things contribute, and they kind of need to be addressed point by point, and what that community's concerns are. But I will say that when I realized how related this was to concern of autism. And the comment you made, Jennifer, that again, I mean, I'm the head of autism services here. We follow over 2,000 families, and we know that they are extremely vaccine hesitant. And so hearing their reasons why they didn't want to vaccinate their younger children, let's say after one child was diagnosed with autism, is just been a commonplace scenario in this clinic for all of my years. So there were no surprises here with this. It just wasn't necessarily put together. So yeah, it's a big challenge.
Well, I want to thank Dr. Shulman. You really did connect the dots of it's very helpful to see that themes are consistent across the vaccine landscape, that this is not just a COVID issue. It does provide some assurances that throughout history, the same myths exist, and they seem to not have come to fruition throughout history. So it does provide some, I don't know, some explanation for why we're hearing the things that we're hearing now. So I want to thank you, Dr. Shulman, for sharing. Thank the captioner for their work. I put our evaluation, which is the link will be for the entire day in the chat. Your next session will start shortly at 10:45, session 2, and I hope you enjoy the rest of your day. Thank you.
Okay, bye everybody.